Good morning. Welcome everyone, all of the Mt SAC honorable retirees. Yay! This is quite the reunion. I was very excited to hear all the chatter outside, so this is amazing. Welcome all. My name is Alexis Carter. I'm the Director of HR Operations and Employee Services within Human Resources. I oversee benefits and have been part of this transition from CalPERS to SISC for the better part of a year now. It's been quite the transition, and I know we've had quite an amount of communication go out to many of you, depending on whether you are Medicare eligible or not. You would have received your own packet in the mail referring to benefit plans you would be eligible for. So we are here to address questions, concerns, general understanding of the new plans that are available to you through SISC, what the transition would look like from CalPERS to SISC. I have Armando here on my left, who is your account manager? Account manager for Mt SAC through SISC. So he is here to go through a presentation for all of you. We will have microphones on either side to run up and down so we can make sure that we can hear you when you ask your questions, and we can address them. You want to have that during the presentation or after? After? Okay, I think that might be better. So hopefully you have a pen. We're passing out what the presentation is. So for those of you in the back, we're passing out the actual presentation so you can kind of follow along while Armando is going through it. You can write notes and questions so that you don't, you have a note to ask those towards the end. And then of course I will be available. I have Asia Simpson, who's our representative from Checkers, who's been helping us through this process as well. We have Zach Gallegos is here. So we have people kind of around to answer your questions afterwards, but I look forward to speaking with you if I haven't already, and welcome Armando.
Thank you, Alexis. Wow, I am so excited to be here and to have an audience. This is great. Thank you, everybody, for coming. My name's, again, Armando Cabrera, and I'm an account manager with SISC. Since I don't know a lot of your faces. I mean, I recognize a couple out there. I recognize Deborah. So I'm going to guess that most of you have never even seen me before, so I'm going to introduce myself. Not only myself, but I want to introduce SISC to you because just to let you know who we are, for those of you that may not know. So SISC stands for Self-Insured Schools of California. So we are an insurance pool that only focuses on school district employees. We're not new. We've been in business since 1979. So we are the largest school-based pool of its kind in the United States, even though we only do business in California. We have over 400 school districts throughout the state of California with well over 300,000 members that make up our pool. Our insurance pool. Through our pool, of course, we are offering these Blue Shield plans, and we are offering Kaiser plans to you. This presentation is going to be a little bit tough for me because I'm talking to a good mix of retirees. So as I was sitting, doing the presentation, and I remember it was 2 evenings ago, and my stomach was grumbling when I was thinking, what would be the easiest and best and clearest way I could make this presentation because of the combination of retirees that we have. So I will do my best to be as clear and as descriptive as I can be. But I do want to, give you some assurance that you are working with a pool that's very experienced. Again, you're not our first college district. I believe we have 15 in our network now of colleges in our pool, community colleges in our insurance pool. So welcome, and I'm going to go ahead and get started. And I am going to ask if you will write down your questions, and we'll ask them at the end, because believe it or not, your packet was almost twice as thick as the actives. So got a lot of information to go through, and I want to make sure I share it with everyone. So first of all, with the first slide that I'm starting with, I just want to remind you this presentation is an overview. There is no way that I could go over a 100-page document per plan for all the plans that are being offered. But I'm trying to get the highest points and detail that I can. So this is just as a reminder, it's an overview. If you want more detail, the documents will be available to you. Again, they're about 100 pages apiece. You're welcome to look at your plans as document for more extensive detail. So this presentation is going to focus on both under 65 and over 65 retirees, or your Medicare eligible, I should say, retirees. So again, the key being retirees. The other way that I want to separate it that'll hopefully help you is district paid medical versus your own paid medical, okay? So let's go. So I don't like to assume that everybody knows this terminology. I know some of us have been around for a while and we're probably very familiar and could probably do a better education of it than I. But I just want to go over some terms so that we kind of better understand throughout the presentation what I mean when I use words such as the word copay. And I think that's pretty much the most common. Everyone knows what a copay is, right? It's just the amount of money that you pay for a certain service. And there are certainly copays or copay language within your benefits summaries today, or your benefit documents. Deductibles. This is the first amount of money that you will pay in a calendar year before your benefit kicks in. So when I use the word deductible, that's what deductible means. Depending on the plan that you have, you may not have a deductible, but that's what the word deductible means for those of you that will have them on your plans. So typically what this means, certain services you have to pay the first amount of money up until you reach that deductible, and then your plan kicks in. If it's a 90% plan, then you're only responsible for 10%, or 80, you're responsible for 20, etc. Percentage of coverage. So again, depending on the plan that you pick, that will tell you if once you've met your deductible, is the plan, again, covering you at 100% or 90 or 80. As a matter of fact, the 100% plan option that you have for those of you that are under 65 retirees that will have the 100A, there is no deductible on that plan. So from day one, you're covered at 100% outside of an office visit copay. Out-of-pocket expense, I really should have used that word maximum, out-of-pocket maximum. That is the amount of money that you will pay for your plan once you have reached that amount, which is basically $1,000 individual, $3,000 for family, and we'll go over that again later in the presentation. So what that means is that regardless if you're on a 90% plan or on an 80% plan, when you reach that out-of-pocket maximum for your calendar year for the rest of the year, you are covered at 100%. Okay, for those of you especially that are under 65 retirees on a district-based plan. Okay. All of our PPO plans, and I'll start with PPO first, are the same with the following exceptions. So what I mean by that to start out with is that we designed our PPO plans so that nothing changes as far as the services that are covered. So you don't have to worry, if I pick this plan, is my cancer treatment going to be covered versus this PPO plan? All of the services are the same. You'll get the same Band-Aids, the same services. The only things that will change between our plans are, again, the percentage of coverage, depending on which plan you pick, the deductible amounts, whether it's 0 or 500 or 1,000, the out-of-pocket amounts, again, whether it's 1,000, 3,000, 2,000, the office copays, whether your plan is a $10 office copay plan or a $20 office copay plan. And then, of course, your prescription copays and maximums. Other than that, the benefits, the services that you receive on your PPO plans are all exactly the same, so they don't differ. It's just the items that I just mentioned. And we did that to keep them simple. Again, some PPO member tips. You know, I'm sure those of us that have been around for a while with medical have discovered that PPO plans work differently today than they did 20, 30, 40 years ago. I've been in this business since 1989, and I can tell you that, you know, both on the government sides of plans and on the commercial side of plans and group plans, they changed a lot the way they work. It used to be that you went to any provider, if you had a PPO plan, all of them were in a network pretty much. You know, very, very few times did you find somebody without. Well, things have changed. There's a lot of providers that will tell you they accept your PPO plan, but that doesn't mean they're contracted with your PPO plan. Okay, or your carrier. So it's one of the things that I like to do when I do these kind of educational type of presentations is that I like to teach folks on how to ask. Especially if you're going to a new physician, don't ask, do you accept Blue Shield? Because what are they all going to tell you? Yes, right? That doesn't mean they're contracted with Blue Shield. That doesn't mean that they are a participating provider in the network of Blue Shield. They'll accept it, but guess what? They can balance bill you. So what that means is that if they charge $100 for a visit and Blue Shield reimburses them the out-of-network physician reimbursement of $50, they're going to still be owed $50. And who are they going to get it from? You, right? They're going to try to bill you for it. They will bill you for it. So that's why it's very important that you're going to have to remember to be very proactive if you're on a PPO plan to ask the question, are you a contracted provider with Blue Shield? So that you know, we are using the same full network Blue Shield network if you're on a Blue Shield network plan, okay? The same full Blue Shield network is the same both for the PPO and the Access Plus HMO network for the HMO, okay? I'm jumping ahead on the HMO. But again, you have to be the one that's proactive to make sure that you are with a provider that is contracted with your network. And here's where I'm going to get I have to start talking about the under 65 versus the 65 and over. So under 65 retirees, you will basically stay on the same plans that are available as your actives, okay, for your groups. So on the for example, with the two classifieds, there are two PPO options, two HMO options, and then, of course, your Kaiser options. On the management side, there are three PPO options, and then there's the Kaiser plans and one Kaiser plan option, which is the $15 copay plan, and I'll get into those, and an HMO. But again, you're going to stay within the same plan options as the active employees, okay? The under 65, okay, in your district paid. All right, so let me go. So therefore, jumping into this first green paragraph here, or under 65 retirees, if you're on a PPO plan, keep in mind that outpatient diagnostic x-rays, imaging, labs, durable medical equipment, orthotics, home health, and I'm getting into some detail here. It sounds like a lot, but it's not as much as it sounds. It's actually 5 categories. Home health services, hospice, chiropractic, physical and occupational therapy, abortion services, family planning, and preventive health are not covered if you go out of network. So it's very important. This is on the PPO side, okay? If you are a 65 and over retiree with Medicare, A and B, this doesn't pertain to you, okay? Under 65 retirees, effective 10/1, I'm sorry, that should have said 1/1 of 2020, but in 10/1 of 18, we added a cap for these procedures if you use a hospital instead of an outpatient facility. With the current, CalPERS has this in place for some of their plans, but they have like 15 procedures. We only have 5. So what that means is that on a PPO plan, if you get one of these procedures done in a hospital instead of an outpatient facility, there is a cap if you use the hospital. So you would be responsible for any costs above the cap, okay? However, there are exceptions because what it is that this was one of those areas that we discovered if these are done in an outpatient facility, they bring an incredible savings to the plan. And because we're a public entity, I didn't say that about SISC, we are a nonprofit. We are actually a JPA that's formed under the umbrella of the Kern County Superintendent of Schools. So I am actually a classified school employee. So I'm not a salesman. I get no bonuses, no perks. So everything that we do as far as our plan design changes, as far as cost saving measures, we do that because we want to pass that cost savings over to you. For those of you that listen to the news, you know costs continue to rise. We've got to do our part to make sure that we can contain costs without reducing the quality of services that our members get. And what we discovered is that 80% of our membership were already using outpatient facilities for the services. So this was only going to affect the 20% that were going to a hospital to get the same thing done that they could do at an outpatient facility at sometimes less than like 20% of the cost of what it was in a hospital. There are exceptions. And here's some of those exceptions. For example, if you live more than 30 minutes away from the nearest outpatient facility to have this procedure done, you can request an exception, and therefore your benefit would cover you fully. If you say your provider, your doctor says, I need this done within the next 3 days, and the next available appointment is 5 days away, that is another reason to have the exception so that you can get it done in a hospital and be covered fully. If you have an existing medical condition, say you have breathing issues, and and it's dangerous to put you under anesthetic for a procedure like this. That could be that's an example of a medical reason why you would need to have it done in a hospital versus an outpatient facility. So we do have these exceptions in place, but I wanted to point this out as one of the differences in your benefit, which again, if you have a PPO through CalPERS, this is already in place with some of those plans, but this is ours for all of our PPO plans. Again, repeating that non-participating providers do have the right to balance bill you, and payments to non-participating providers do not accrue to the out-of-pocket maximum. If you're not sure, call Blue Shield. You will be receiving a Blue Shield card. For those of you that are that are retirees with Medicare, that are going to be on the PPO, what we call the AGWIP plans, that's that EGWP plans, you will get 2 cards. One will be your pharmacy card, one will be your medical card. But you will have a Blue Shield card, a number that you can call if you have any questions at any point throughout the year. So you don't have to wait until there's an incident or you need a certain service. Blue Shield is there and available to help answer questions. Again, some tips, ways to save. All of our PPO plans, preventive services are covered at 100%. You don't even pay an office copay. So if they try to charge you one, retirees on our PPO plans, remind them that your plan does not charge copays for a preventive visit. Okay. So we also recommend urgent care or MD Live for non-emergencies rather than an emergency room. It'll save you money, and quite frankly, it saves the plan money. Let's be transparent, right? MD Live is a service that's going to be available to you. It's a 24-hour, 7-day physician line, so you're not speaking with nurses or mid-levels, you're actually speaking with physicians, and it's not meant to be ongoing health care or a replacement for, say, your cancer treatment center. It's like, hey, I've got a bit of a cough, might want to, speak with a physician, or I've got a fever, or what have you. This is my most popular product that when I'm at an open enrollment event or at a health fair that young moms with children stop me at because they love it. It's very convenient. It's $5 copay. As long as they can diagnose you over the phone, they can prescribe. They will not prescribe the controlled substances. So, but it's MD Live, and it's another item that wanted to point out as a cost-saving tip. Talk to your doctor about using generics. As you all probably have heard this bill before, by federal law, all generics have to have the same active ingredient as a brand. The differences are going to be typically your fillers, but they are a cost-effective means by which to access prescriptions. Kaiser's probably one of the champions in generics. I think over 90% of their members use generics, so certainly a viable option. If you're on our PPO plans, we have something called fourth quarter carryover. So your benefit will start October 1st, but our benefit year from moving forward will be from October 1st through September 30th. Now let me clarify. That is the benefit year. That's not the calendar year on which you build your deductibles and out-of-pocket maximums. This is why, one of the reasons why we added what we call a fourth quarter deductible carryover. So what happens is that typically districts will start October 1st with us. And let's say you had a kind of a bad last quarter, even though you just started with us, and you spent $200 towards your deductible. Well, what happens typically to a deductible on January 1st, since it's the calendar year of accrual? On January 1st, that $200 you kind of wave it goodbye, right? It's no longer there. It's gone. You can't use it anymore. You can't use it anymore for your benefit. Well, with SISC, if anything you spend in October, November, and December towards your deductible, those amounts get carried over to January 1st, and it's available to you. So in this example of $200 you spent, you've got that as a head start towards your deductible for the remainder of the next full calendar year. Okay? Does that make sense? Okay. So that's our fourth quarter deductible carryover. All of our PPO plans have that in place. When to call Blue Shield. I know it's going to be a change, especially for some of my districts that I brought on that were direct. We're used to kind of going everything through the district. Of course, I want the district to hear if there's an issue, but your first step, if you're having an issue with a claim or something doesn't seem right about your bill or that EOB stands for explanation of benefits, or if you can call Blue Shield and ask that question first. 98% or more of your issues are going to be resolved. It'll save you time. It'll save us time. It'll be far more efficient if you call the carrier direct. And the same will be with Navitus, your pharmacy benefit manager, that I'll get into here in a second. If you need a new ID card, you can call Blue Shield, especially for those of you that don't like to get on the internet and do this kind of stuff. You can certainly call them, and they will mail you a new card if you don't have one or if you lose one. Say you go to your doctor and he says, I'm not covered. Make sure you let the district know, because either somehow maybe either an enrollment form didn't get to us, or maybe if someone at SISC didn't input it right, or as happened yesterday, one of our members called the carrier and the carrier told them they weren't enrolled, and then when we looked into it, it was a newer customer service rep that didn't look in the right space. So that can happen. So so these are all very solvable things that can take place. Always know that if you're supposed to be effective January 1 and you didn't discover till February that somehow you weren't enrolled, we always retro enroll you back to January 1st. So you will be covered for any services that you have within your coverage period, okay? So I did add our microsite, that www.blueshieldca.com/SISC. It's very specific to our SISC members. You can look up providers there. There's going to be some other great information that I'm going to talk about here in a few minutes that's available on the website. So take advantage of it and look around for those of you that are Blue Shield members. Choosing the right plan, I don't really need to go into this in too much detail with retirees. I'm sure you know what you're on, what you like, what you're going to pick. But I always tell people, don't choose a plan based on what your neighbor likes or what your friend likes. Everyone has different needs. For some, HMO works out better than a PPO. Some like the luxury of having a little bit more flexibility of the providers they go to, so they want a PPO. So each employee, has different needs. So make sure you pick your plans, of course, based on that. And of course, if you're covered with the district, then really the choice is absolutely yours, because you have no payroll deduction to worry about. So sometimes what has happened, and I've had this experience, and this is why, as a person that believes in education, and because I work for a school district, I love educating people, and I've stopped folks from switching to a plan that was going to cost them $1,600 more a year, because their average visits, based on what I evaluated on their visits, they were going to spend $1,600 to save $40 in a calendar year. Not a good move. Okay, so again, just some awareness information. So when you come to SISC, there are lots of value-added services that are added. And before I go into the plans, I want to talk to you briefly about these. So in the back, there's, as some of you may have noticed, I had a couple of tables outside the auditorium that have information about our value-added services. If you're not one that likes to pick up a lot of paper, if you just simply pick up this flyer, most of those value-added services are mentioned here, along with the contact information and very basic introductory information. So if you don't want to pick up, 8 flyers of each one of these items that go into more detail, this flyer is certainly available to you with the contact information. So here are some of the value-added services that come just by being a member of SISC, and I will mention whether they're available to you as a Blue Shield member or as a Kaiser member or both, okay? So for those of you retirees that are going to be on the PPO plans, MD Live is available to you, and it's a $5 copay for virtual office visits, again, with physicians. I mentioned that earlier. If you are, here's what's going to get a little tricky. If you're an under 65 retiree, you have zero cost option of going to Costco for zero cost generics. That's an option. You still have other pharmacies available, with the exception of Walgreens. Walgreens is the only pharmacy that's not part of our network. So for your generic prescriptions, your brand prescriptions, you can go to any pharmacy except Walgreens, okay? If you want zero cost generics, you can go to Costco. For those of you that are Medicare retirees with A and B that are going to be on the PPO plans, you have a little bit of a prescription richer benefit because you're going to be on what's called an AGWIP pharmacy plan. That means that on that plan, for those Medicare retirees that are on the PPO plans, very specific, you do have access to Walgreens. You do have access to zero cost generics at all retail pharmacies that are participating retail pharmacies. And you can get your 90-day prescription fill at any pharmacy, not just mail order, not just Costco. That's for your those with Medicare A and B on AGWIP plans. The rest of you that are on the that have the PPO plans, again, You get zero cost generics, but only at Costco. Your mail order is only through Costco, even though other vendors do offer it. For us, for specialty drugs, and all the other drugs really, it's only through Costco for your mail order, okay? Advanced medical, expert medical second opinion. This is gonna be very important to many of you, especially if if you're going through some conditions right now, or you say one you've been recently diagnosed with, or whether it's one that a condition you've had for a while and you're not getting better. We have a vendor called Advanced Medical that actually provides second opinion service to anybody that wants it. You're not obligated. We won't know about it. This is between you and Advanced Medical. So what it is I'm just going to use an example just to give you something. Say, let's just use the big C word. I've got cancer. I've recently been diagnosed, or I've had it and I'm not getting better. I want a second opinion. I call Advanced Medical, let them know I'm a SISC member at zero cost to me. When I call, I will be speaking with the team, and I will sign off a medical release that lets them go out and get copies of the medical records that pertain to my cancer treatment and diagnoses. What they then do is Advanced Medical is contracted with world-renowned physicians throughout the country, many of which are published, many of which are heads of their teaching institutions or very well-known hospitals. And what they do is they kind of reach out, get those records, put them into an electronic file that is then securely sent to 2, sometimes 3 of these specialists within that specialty, within whatever it is that you're wanting that second opinion in, so within that specialty. What they do, they will review the medical records, and they do one of 3 things. In case you didn't know, one of the reasons we brought this service is that we discovered that 3 out of 5 medical conditions in this country are either misdiagnosed or mistreated. And so what they will do is the service will do one of 3 things. They will confirm diagnoses. Looks like the right diagnoses. You're on the best treatment that you can be on. And they provide you this information. You will have a physician that kind of becomes your liaison between you and Advanced Medical to discuss your case, if you have questions, if you have concerns. Just the data for last year for only our SISC population that used Advanced Medical, the average time that your liaison physician spent with you was 163 minutes. I don't know about you, and I know you go to a lot of visits, especially if you've had some conditions, but I don't know very many physicians that spend that amount of time on your case. But it's a great service. It's free of cost to you. So let me get back to what they'll do. So they'll confirm diagnoses, confirm treatment. That's one option. They might confirm diagnoses, but decide or offer, hey, you might want to speak to your specialist and add this regimen, okay? Let me give you a real-life scenario case. We had a young case that was brought by a subscriber and spouse. They brought their son's case to Advanced Medical. Their son was, I believe, 19, 20 years old, and they discovered he was in an advanced stage of cancer, and it was very aggressive. And they basically gave him 6 months to live. So they brought his case to Advanced Medical. Long story short, all they did was add one regimen of drugs one drug to his regimen of drugs that he was taking. Within months, he went into remission, and he is alive today. So Advanced Medical, again, it's a great service. It's available to you. We've heard lots of great positive feedback. And the third, which is the one that we hope not, but they might come back and say, based on the medical review of the labs and the tests that you've been given, we don't believe you have the right diagnoses, and you might want to go back. And if it's not the right diagnoses, this treatment's not going to work for you. Okay, so again, great service. Sorry to spend so much talk about it, but I love this one. It's one of my favorites, so I love to talk about it, and it's at no cost to you. Another thing that's available to those on district plans is our EAP. It's the Employee Assistance Program. It's administered through Anthem, but they provide all kinds of support services to you. Anything that involves your family, your lifestyle, whether it be needs for counseling, whether it be you need a babysitter, you might need to speak with a lawyer about a certain case, just some basic kind of just a one-time consultation kind of thing. They're not an ongoing legal service, but they'll at least do, a sit-down talk with you, a financial planner, that kind of information. And I'm just barely touching the surface on what they have available. It's a very underutilized service, and we certainly encourage you to use it. And let me tell you, folks, this is not only available to you as a district employee, or retiree, I should say, for those of you that are on the district plans, but it's also available to anybody in your household. Okay. Moving on, the Blue Shield members, this is also available. And by the way, EAP, Advanced Medical, are available to all members, whether you're Kaiser or Blue Shield. Okay. Activity Health is available to our Blue Shield members. It's a gym membership discount program. They have a network of gyms that you can join, $25 registration fee and $25 a month. And that's for Blue Shield members on the district plans. Solera for Me is a pre-diabetic program that's also offered through Blue Shield. Carum Health is an additional option for those of you that are looking at a hip or knee replacement or certain back surgeries, depending on the type that it is, through a vendor called Carum Health. Carum Health contracts through Scripps in San Diego. So if you choose to use Carum Health, which is an option, again, it's just another option besides your typical network that you have available to you. If you have a deductible, it's waived. If you have a copay, it's waived. If you have to, of course, travel to San Diego, they will reimburse you for all travel expenses for you and a companion. Okay, so it's a great benefit that again will offer you 100% coverage regardless of the plan that you're on, and it waives your deductibles. Okay. Wellness discount programs are also available through our Blue Shield members. Alternative care discounts for chiropractic, acupuncture, and massage services. Especially those that may not be under your plan. Health and wellness products, you can get up to 50% discounts on popular health and fitness products. So look at it almost like an online store that's accessible, again, through Blue Shield. QuitNet is another Blue Shield vendor that is used for smoking cessation. Again, it's free of cost to the members. Epic hearing aid discounts available through Blue Shield. Discount vision program is also in addition to VSP discounts, you can also get discounts for vision services through Blue Shield for those services that are not, like for that second pair of glasses or contacts or what have you. So again, just touching on some of those value-added services. I know this doesn't come up as much with older, well, I guess it does with with Medicare eligible retirees, but primary versus secondary, especially when you have two retirees that are under 65. I mean, there's can be made differences in combinations. So I'm just giving you the basics about coordination of benefits and what is primary, what's secondary. So I should have added this as a line for you. So for Medicare beneficiaries, as you know, your Medicare becomes primary and your medical plan is your supplemental or your secondary. I kind of do this as an add-on because in some education that I learned when we brought on Palomar Community College District in San Diego, we had retirees that had both plans, and there were a couple of cases where the retiree was told, "Oh, your supplemental will not pay for that," okay, automatically, just because it's a supplemental. The thing to remember is that if you're on a district PPO plan, your plan is more than just a supplemental. It's a full plan that stands on its own. So if your provider just kind of, "Oh, it's your supplemental," they won't pay for it. Tell them, "Would you mind please checking, because I believe I'm on a full plan and I may have coverage for that." Because I've had tests rejected because Medicare didn't typically cover for them, but they were covered under the PPO side of the plan. Okay, so your PPO plan is more than, it is your supplemental, but it's more than just a supplemental because it's a full plan that's serving as your supplemental. Okay, so but. That was extra, sorry. So again, primary versus secondary. For those of you on that might have coverage through a husband and wife, one is maybe at Mt SAC and the other one could be at company ABC. Whoever is subscribed under their plans, that's your primary. Okay, even if say your Mt SAC plan is richer and your spouse wants to use it, unfortunately you have to bill their plan first. Then your plan becomes secondary for whatever the balance is. But remember, folks, you've got to make sure and present both cards to your physician so that they know when they bill for them, and their plan, who doesn't cover 100% or whatever it may cover, doesn't cover it all, they're not billing you. They're going to bill your plan now as secondary coverage, okay? What happens if you have kids, okay? If you're retired and you got kids, you go, but that's awesome. Second youth, you know. But if you have children and you both have your own separate plans, remember that whoever's birthday month comes first in the calendar year, that is primary coverage for the children, okay? So in my family's example, you know, birthday's in May. She's a month and 3 days older than me. And I'm in June, so her plan always serves as primary, mine serves as secondary, okay? So bad. I like to have fun. Okay. I'm in insurance. How else am I gonna have fun? All right, so let's go into some plan information here. So I do apologize for some of the small print on this. I do have these summaries printed also that we can pass out if you would like a copy of it. Alexis, did we include those in the packet when we mailed them out? I don't know if we did. No, we didn't. I think we did something else. So this is a side-by-side comparison. And again, folks, it's going to be different based on, again, if you're district paid or if you pay yourself, okay, and whether you're on a district plan or what we're calling our individual retiree plans. And I'm going to go into detail here now. So bear with me. I'm sure you'll have lots of questions. Okay, so this comparison is for those, this is the easy one. Under 65 retirees, if you would have came to the active presentation, everything I said there would have pertained to you. So yours is the easiest. So depending on your bargaining unit, whatever plans are available to your active employees under your bargaining unit, under 65 retirees, those plans are available to you as well. So you're basically keeping the same plan as actives. They're going to work exactly the same as your active plans, okay? That's the easiest part of this presentation because the rest, I'm going to be growing gray hair, okay? Talking about the differences. All right, so here we go. So for the classified group, remember what I said about our plans? What's medically covered, the services are exactly the same. So especially on the PPO side, they don't vary, folks. It's the same services. You get no less Band-Aids, no less Q-tips, no less surgeries, no less coverage as far as the services that are covered, I should say, okay? The differences, so that's why the left column is all exactly the same. But when we start looking at our Blue Shield plans for classified, there are two options that you have available. Because every unit gets up to 6 plans, so the classified chose to have 2 PPO plans, 2 HMO plans that are medically the exact same plan. The only difference is one is the full network, the other one's the trio network, okay? And they wanted 2 Kaiser plan options. So under 65 retirees, these are your options. So as you can see, going across, Kaiser's easy. If you use Kaiser now, yeah, your services are going to be exactly the same facilities. If you're visiting Dr. Jones, you're going to continue to see Dr. Jones. If you're going to, the facility in wherever, that you can keep going to that facility. Everything is going to be exactly the same. As a matter of fact, you may not even get a new card. Okay, the only ones that will be getting a new card are if it's been more than 365 days since you've had a card, and since you're starting a new contract, they might send you a card. If your name changed, any of your other information, date of birth, your medical record number will stay the same, so there won't be 2 separate medical records now because you're switching. It'll still be, Kaiser will still work as Kaiser. So that's comforting. Kaiser members can be excused. Just kidding. All right, so Blue Shield, the PPO plans, as you can see, the 100-day plan is a very rich plan. There are, and by the way, I'm in denial, so I have to do this to see you, and I have to do this to see this, and I get myself confused sometimes. But so on the 100-day plan and the 90G, I'm going to compare them together since they're side by side. The individual and family deductible, remember that's the first amount of money you pay before your plan kicks in for some services. Okay, so the deductible for the 100A plan is $0, whether individual or family. The 2 numbers with the slash, the first number is individual, the second is family. So if you're a family of 4, okay, your deductible is $1,000 for a family. But if, say, you're the one that's sick and needing the medical benefit the most, even though you're a family of 4, you don't have to reach $1,000 by yourself because you're enrolled as a family member. Your deductible is $500. Once you reach it, then your plan starts covering you at 90%. The 100% people, y'all are lucky. You got a great plan. You've already started at 100% and zero with no deductible. So from day one, if you go to the doctor and you need, Lord forbid, something major, you're covered at 100% for your services, okay? Remember, everything I talk about, by the way, we're talking in-network here, okay? All right. Out-of-pocket maximum are exactly the same. Same thing, $1,000 for individual, $3,000 for family. That's the number I worry about. Because in your worst medical year, and we had a very catastrophic, horrible accident with one of our members up in Northern California, $7 million in claims, folks. Horrible, horrible. And the worst part about it is that we spend all this money to save the poor person's life, and they ended up, unfortunately, passing away after 2 months. But it's the way plans work, right? But out of that, they only had to pay up to their out-of-pocket maximum. So whether it was $1,000 or $2,000, all of your PPO plans are $1,000, $3,000, okay? So great out-of-pocket maximum amounts. So those of you, again, this is for the under 65. I don't want to switch back and forth right now because I'm going to confuse people. So the office copays, if you notice most of your office visits, if you're healthy and you just go to the doctor if you go again for your annual exam, you don't even pay the $10 or the $20, okay? You're paying nothing because it's a preventive visit, and that is going to include your preventive lab panel, okay? So you're not having to worry about that. Okay, real quick, let me give you this tip. The deductible. So Armando, what do you mean when I reach the deductible once I have to pay for everything until I reach the deductible? Which services are those? Anywhere you see a percentage, which let's not even look at the 108 because they don't have a deductible. They're 0%, everything's covered, meaning 0% that you don't have to pay for nothing, okay? On the 90G plan, anywhere you see a percentage, so the first one being the CAT scans, MRIs, etc., where you see that 10%, if you go to get one of those and it's $1,000 for that MRI, you're going to pay the first $500 under the 90G plan. The other $500, you'll be paying 10% of $500, so it's $50. So $550. But that's for calendar year. That's not per procedure. So once you reach your deductible for the calendar year, then you're covered at 90% for the rest of the year. 100% planners, you guys started at 100, you're going to end at 100, okay? So it's a great, rich plan. But, so let's go back to the office visits. Office visits, your urgent cares, specialists, prenatals, those are just an office copay. Do you have to pay the first $500 for those to just pay the copay? No, you don't. You just pay your copay, okay? So that's where, whether you're on a 100% plan, well, because this 100% is a $10 copay, but we also have a 100% plan with a $20 copay. In this case, it does make a difference in the copays, but in most cases it won't. But it's just your copay. MRI scans, again, you're paying your deductible and then the percentage of cost after that. X-rays and labs. And let me point out, for this, remember, we're only talking under 65. So 65 and over, just shut me out for a little minute, okay? If you're under 65, you don't have Medicare, okay? For CAT scans, your diagnostics and labs, remember, those are services that you have to stay in network because there's no coverage out of network for those. Highlight it, circle it, star it, okay? It's also part of your plan documents. Infertility benefits is not covered. Retiree meeting, but infertility in case you want it. I mean, I'm sorry, but it's not covered. Preventive care services, sorry. I'm going to have way too much fun with you guys. Preventive care services, again, zero cost. Doesn't matter which plan. Emergency room. There is a $100 copay for emergency room, which is waived if you're admitted within 24 hours, okay? Inpatient hospital, outpatient hospital, surgeries. You do have to meet your deductible, and once you do, you're covered at 90%. 100%, you already know the answer. Okay, mental health and substance abuse treatment, inpatient, facility-based. You just are responsible for your percentage of coverage. Outpatient, the same. Other services, acupuncture, there are limits that apply. You get 12 visits a year for acupuncture that are available to you. For ambulance, ground or air. Have you ever seen the prices of air ambulance? Oh my God, this is a great deal, by the way, $100 copay. $100 copay, but it's and of course your percentage of your services that you may be receiving. I'd be asking, like, how fast are you going to get me there? Don't give it to me. I'll wait. Chiropractic, limits do apply, but you do have up to 20 visits a year, for a calendar year. And those services, again, you're paying for your percentage of costs. Durable medical equipment, 0 and 10% respectively is what you're responsible for. Physical and occupational therapy, 0 and 10%. Let me back up a bit. Chiropractic medicine, physical, let me think for a second. No, I'm sorry. See, I had to pause. That's Anthem, not Blue Shield. Scratch that. All right, hearing aids. For hearing aids, we do have some, any amount that is in excess of 700 allowance, 24 months, is available to you. You're responsible for 10% above that 700 on the 90G plan, okay? Okay. Turning the page, so let me talk a little bit about, and I'll get into more detail about pharmacy, but this is the pharmacy plans that you will have. All of your Blue Shield plans have the same exact pharmacy plan, same formulary. Not to jump ahead, but remember, AGWIP people, Medicare 65 plus, this doesn't pertain to you because you have different copays. But those of you that are under 65, these are your copays. $5 for generics, $20 for brand. If you choose to go to Costco, you can go to Costco for generics at a zero cost to you. The exception to that cost is if they're controlled substances, again, any narcotic-based drugs, they're covered, they're just not covered at $0. Mail orders through Costco, the pharmacy benefit manager, I think through most of your plans now is like through Optum, I believe. When you come to SISC, effective January 1st, it will be Navitus as the pharmacy benefit manager, and I'll get into more detail here in a bit. By the way, did you know that you could go to Costco without a membership to access the pharmacy? Yeah. Just want to let you know. You don't have to be a member of Costco to access their pharmacy. You also don't have to be a member to use the deli or buy tobacco or alcohol. So I tell people all the time, you can go to Costco without a membership and get your drugs and alcohol. Just do it. And then get a pizza, if it makes you hungry. All right. All right, so that is your pharmacy benefit. It does have an out-of-pocket maximum, meaning that if you reach it, if you by chance do reach it, which could be possible, you don't pay for anything after that. It's covered at 100%, okay? There's no more copays after that. All of the mail order, again, is done through Navitus for specialty drugs, and the others is through Costco. Let me back up and go through HMO real quick. That's going to be the easiest. So I'm going to go back one page. See, I told you guys I was going to have a hard time with this one. So on the Blue Shield plans, the HMO benefit-wise is exactly the same. If you notice, I added in red the words Trio Network. That's the only difference. Everything else is exactly the same. It's still your Access Plus HMO network. So if you've got a medical group that you're accessing through Access Plus, unless they ended their contract last month, they're still available to you. Well, if they did, you'd know about it by now, actually, on your current plans. But effective January 1, you will be using, these will be your plans. Very, very rich plans. Let me go through them very quickly. $10 copay for all of your office visits, including specialist copays, for your prenatal or postnatal office visits, you actually don't pay anything for those. Your scans, your MRIs, your diagnostic x-rays, all zero cost to you. Infertility benefit, never mind. Preventive care, same thing, zero cost to you. Hospital skilled nursing, there is a $100 copay that is waived if you're admitted, again, within 24 hours. But your inpatient procedures, outpatient procedures, all of those are you pay zero for those. Mental health and substance abuse, if it's inpatient, you pay zero cost. If it's outpatient, you pay a $10 copay per visit. Your acupuncture and ambulance. So let me pause here for a second. For those of you that have been around, you probably know by now that the AMA doesn't necessarily recognize chiropractors as their equal, all right? It's not. We ran into this several years ago with our HMO plans because some folks like chiropractic medicine to be part of their treatment, So they were having a really rough time getting visits through their primary care groups. So we added a rider. So let me talk twofold here for a second. When it comes to acupuncture and chiropractic services, probably the most that we ran into is chiropractic. You have two ways to access it. Through your medical group, which could be limited as to what they will allow you to do, if any, okay? Because they might want you to see the DO first, which is, I call that the physician side of the chiropractor world. And so you can go through your medical group and you will pay your medical group copay, and you got your medical group's blessing. They send you to one of their contracted providers to get the service, okay? And if you can get it that way and you're getting it that way, great. However, you have another option now. We add a rider to all of our HMO plans. It's called our Chiro Acu Rider. That means you self-refer yourself. You don't go through your medical group, so don't call your medical group asking about the rider, because they're going to go, huh? You know, they won't know what you're talking about, because that's part of your medical plan outside of your, in addition to your medical plan. That's why they call it a rider. It's an add-on. You self-refer yourself, but you have to, oh, and by the way, when you go through your medical provider or group, remember, it's their contracted acupuncturists or chiropractors, okay? When you go on the rider side, you have to use the ASH network of providers for chiropractic services and acupuncturists. It's a $10 copay. You get and it's combined up to 30 visits a year, okay? So you could do all acu, you could do all chiro, half and half, a quarter to three-quarter, but 30 visits a year is your maximum, and it's, of course, based on medical review of your necessity. You just have to use an ASH chiropractor or ASH acupuncturist. Once if yours is one, they know the process, they evaluate you, they send in the request for additional visits, but you can get up to 30 a year under the rider, okay? And then the Kaiser plans, Kaiser's Kaiser, are unless there's something specifically that we need to get into, I do want to mention that with our Kaiser plan, the difference also is that we have the rider for you too. So you can also use chiro, and for chiro and acu services, you also have a rider available to you. If any of you have picked up any of our summaries, that rider is attached to the back of it, okay? And you can certainly get the copies are also posted on the website, right, Alexis? Yes, she's saying 2 thumbs up. So if you want a copy of that information, it's also there and available to you. Flipping back again to the pharmacy side of things, it's the same pharmacy plan as the PPO HMO members. So for your Kaiser options, as far as pharmacy costs, on the $15 plan, you have a 520 RX plan, 30-day limit, meaning that you get generics for $5 and you have a 30-day limit. You get brand and specialty for $20 for a 30-day limit. You can get a 100-day supply. It just doubles in cost to $10 copay for the generics and $20 for brand, $40 for brand and specialty for a 100-day supply. It's like Kaiser. You're still using a Kaiser pharmacy, so that won't change. All right. Whew. Okay. Under 65 management, everything I just said is exactly like you, with this exception. See, I've been planning this. I knew how I was going to do this. So, the only difference with the management group that are under 65 is that your plan options are just a little different. Under the Blue Shield, there is an additional PPO plan, because there's 3 PPO plans offered. It's the 80G20. Same services. The deductible is exactly the same. The out-of-pocket is a little more. It's $2,000 individual, $4,000 for family. And again, this is for management and board of trustees. Ooh, I cut off trustees. Board of trust. All right. So, so the 80G plan, the only difference is that when you reach that $500 or $1,000 deductible, whatever the case may be, your plan covers you at 80%. So wherever I said 10% before is now 20%. Everything else I said is still the same. Okay? The other difference is that instead of having 2 Kaiser options, you only have the one, and it's the $15 office copay plan that I just covered. Still works like Kaiser, same everything like Kaiser. It's the pharmacy plan that's $5 for generics, $20 for brand, 30-day supply. You can get a 100-day supply for $10 on generics, $20 for brand and specialty. Okay? I want to get in the habit of saying any questions, but we will be here for a long time if I start doing that. Please hold them until the end. All right, 65 plus. This is our Medicare eligible retirees that have district paid medical. Here's your plan options. I simplified it a little more for you. So in addition, these are, what I wanted to do is just present to you the kind of like the district-based plans that you have available to you. The difference for you, Medicare eligible retirees, is that you're gonna have the same exact 100A plan as the actives, 0 deductible, $10 copays, et cetera, but you have Medicare. So there's some differences, a little bit of some differences. Those things that I said you have to stay within network to have coverage for, those won't pertain to you. Why? Because Medicare is primary. By Medicare being primary, it already cuts back on some of the costs to the plan. So you have a little bit more access. You don't have that much as network limitation for those, like I said, the labs and stuff that you have to stay within network, okay? Your biggest plus is your pharmacy benefit. You will have 0 generics, not only at Costco, but at any pharmacy, including Walgreens that is contracted, okay? So it expands, so you still have access to Walgreens. If you are on what we call the AGWIP plans, that's the 100A, and the 100G plan. The 100G difference is that it's still a 100% plan, but it has a $500 deductible, and the office copays are 20 instead of 10. Benefits the same, percentage of coverage is the same once you meet your deductible, okay? It's also under Blue Shield, okay? That's for the 65 plus. If you are on an HMO and you're gonna be retiring with the same district HMO, here it is. It will work exactly as it did as an active member, except now, of course, Medicare is your primary and your HMO plan is your secondary, okay? So these are your 4 options. Everything I explained about the HMO before still pertains to you, okay? The pharmacy plan for the HMO is the same as what you would have had as an under 65 retiree or as an active employee if you were with us now, which is the 520, okay? So the only ones that have the different pharmacy, little richer benefit, is those on the 100A or the 100G plan, which we call the AGWIP plans. So if you're district paid, hey, those are really good plans. All right. I'm going to talk about another group of plans, but I wanted to separate them so that I reduced confusion, okay? If you're an under 65 retiree, I have given you your options. If you're a Medicare eligible retiree, district paid, this is the majority of your options, and there's 3 more that I'm going to talk about. Hold on, Kaiser members, I got something for you, okay? Don't worry yet. But before I go there, I want to talk about Navitus. So, currently, most of you, as I said, through CalPERS, you have Optum, I think it is, as your pharmacy benefit manager. We have Navitus. Navitus has been a great partner for us since April of 2014, so they're not new to what we're doing. Way back when, for those of us that have been in the world of medicine and we like to read stuff because we're nerds, I'm a nerd, about 7-8 years ago, I had read federal, report on the escalating, at that time they said there were escalating costs in pharmacy. It's like, have you seen the last 3 or 4 years? I mean, that's escalating. But anyway, they were saying, that at the rate that pharmacy could escalate, by the year 2020, most large group plans, which is what we are, 20% of their costs will be pharmacy. So back then, the feds could already see the writing on the wall, okay, that pharmacy costs were gonna be a big contributor to cost. And so by the year 2020, 20%. That happened this year. So there are group plans in this country that 20% of their medical costs are prescription. We are at 16.7 so far. And Navitus has helped us get there. Now, if you're Kaiser, you still stick with Kaiser. You're still doing your Kaiser thing. They do a great job of managing their pharmacy plan because 90% or more of their members use generics. With us, we use Navitus. Navitus has been recognized by CMS. They have Part D federally approved plans. They do a really great job of managing our benefit. Now, I've said that to say there are 3 things that Navitus uses when they're evaluating our formulary. By the way, the formulary is also posted on the website. I believe Alexis already confirmed that earlier. The formulary is on the website, the one I shared. Yes, okay. If you want to take a peek at it. How Navitus determines drugs are covered is 3 things, 3 basic things. Therapeutic value, They also look at the effectiveness and the side effects of each drug. And of course, we have to look at cost, folks. Because again, we're nonprofit, so we're not trying to fill anybody's pockets. The reason for wanting to do any kind of cost containment measures is because we pass that cost down to our districts. We are one of the few pools, maybe one other, that can brag that for the last 6 years, our increases have never been more than 2 digits statewide for all plans. And we have two of the highest cost centers in the country in California. So one of the ways that we're able to do this is by using Navitus. So they use this step in order to evaluate what drugs get put on the formulary. Navitus does add new coverage and limitations or remove certain medications from coverage on the formulary, and it could be on a monthly basis. Doesn't always happen monthly, but I'm just giving you the worst case scenario because I like to be transparent. I really like to, I don't like to hide anything because I have nothing to hide, folks. Why does that happen? If new drugs are approved by the FDA, including specialty brand and generic drugs, if an existing drug is discontinued by the FDA because of safety measures. Existing drugs are reclassified as over-the-counter. If it's an over-the-counter medication, Navitus pretty much leads the way as far as like not covering those that are over-the-counter medications. They're over-the-counter because they're more cost efficient, so we don't cover them. So we do that again to maintain costs and to be able to not remove what you don't need. We don't want to do that. As a matter of fact, my next line says, the above changes are never done without providing you therapeutic options. So we do it to maintain the high quality and safe and effective alternatives that are available, okay? Again, effective 1/1/2020, Navitus will be your pharmacy benefit manager if you are on a Blue Shield PPO and the district HMO plan, okay? Now, some covered medications do require step therapy, so I want to warn you. In about another month, I'm gonna provide a flyer that's gonna give you some guidance if you wanna check in on some of your drugs ahead of time. You can look at the formulary now. In that formulary, there's a column with a little index on the bottom that tells you if your drug requires step therapy or prior authorization, or if it's a generic, which just means it just needs a prescription or whatever the case may be. If it doesn't require anything, it won't say anything in that column, okay? But if it does, at least you'll know ahead of time so that you can be prepared to do what you need to do. If you're going to do mail order, you will need to do a new prescription for the mail order because it's obviously a different vendor, so they have to have a prescription if you're going to do mail order. Every case, of course, has individual medical needs, and it's those needs that determine the approval of specific prescriptions if they do require a prior authorization or step therapy. Everyone's case is different. Again, the network includes most pharmacies. I have, knock on wood, not ran into even some of the small town local pharmacies that are not contracted with Navitus. The only one that isn't for the commercial plans is Walgreens. Again, AWIT members that have the Part D formulary, you're the exception. You do have Walgreens, okay? The Medicare enrollees on the district plans that will have the AWIT plans, let me tell you first, you will have 2 cards effective 1/1. One for your medical, one for your prescription. Everybody else, the under 65 retirees, those that are not, that are paying for their own benefits, that are not on the AWIT plans, you will have one card that has your pharmacy information on it. So one card for both medical and your pharmacy, okay? If you're filling a retail prescription at your local pharmacy, this is really important because I get this is like the #1 problem that happens. Your pharmacy probably knows you, especially if, as we get older, we use them a little more. And, hey, Jane, come on in. It's good to see you again. Oh, you have a prescription. Okay. You hand them your card. She's not even going to look at it because she knows you. She's been, they've been doing business with you, right? They'll process your prescription, and then all of a sudden they'll get this back that says, their contract's been terminated, or they're no longer covered. And you're like, what? What did this do to me? And I'll get the phone call, and, everyone's in a panic, and I don't want you to panic. I promise you I don't, What typically happens is, since they're used to you, or it's just regular business's day, they don't even look at that card, and they'll try to bill under your old contract. Well, when does your old contract end, or when will it end? December 31st. So they're getting a message for your old contract. When you go to fill in a prescription after January 1st, this is just an added tip to you, make sure you say, hey, I've got a new prescription plan, okay? That way they make sure that enter that new bin number so that it doesn't get kicked back, okay? So just a tip for you, because that's probably my number one thing that happens with a transitional district that's coming from one pharmacy plan to another. Again, filling a mail order prescription to be delivered to your home. You can do it online or by calling Navitus. This is the Navitus number. This is their website. You won't, unfortunately, be able to register until January 1st, but what I'm going to be providing is a flyer that will give you some guidance if you want to check on your prescription directly through Navitus instead of just going through the formulary. Okay. So, but this is the call number that will also be on your member ID card. Okay, we're done with that part. Here comes the fun part. So we also have something that we call individual retiree plans. They are group plans. They are through SISC, but we discovered through our talks in getting your district set up that there are retirees that may want to stay on district plans, but they're not eligible for district paid benefits, okay? We have what we call IRPs. They're usually a very welcome benefit to some of our, especially our elementary school districts who no longer provide benefits or options for benefits to 65 and over retirees. It's kind of a sad situation. So this is why I love IRPs, because it allows those that maybe can't afford their district plan on their own or their district never allowed it, to be able to still kind of be under a group plan. As long as their district remains with SISC, they can have access to these individual retiree plans. One of those plans is kind of like a visiting cousin. It's the same plan that goes to cousin locations, and that's Kaiser Senior Advantage. For those of you that have ever retired on a Kaiser plan, you know that once you turn 65, you are automatically moved to Kaiser Senior Advantage, no ifs, ands, or buts, or there's no option. You're on a 65 plus Advantage plan. So it's the same exact plan that you would have whether you were getting it over here on the district side or getting it over here on the individual retiree plan side. I was gonna put it separately, but I thought that would have brought more confusion. So I thought, well, let me just put it where it belongs. It's one of our IRPs that's also your retiree plan if you're an active member that's retiring as a Medicare eligible retiree, okay? It's Kaiser Senior Advantage. So that's the first plan that I have listed there as one of your options. It's an HMO-based plan, for those of you that didn't know. Blue Shield 65 plus Advantage plan, a little bit of a different design. It's still administered by Blue Shield, but it's an HMO plan for 65 plus retirees. So I will go into some of those details so you can see just a few differences, not much, but some. And then we have a plan called Companion Care. It's administered by Anthem Blue Cross. And I had a great conversation with one of your retirees who's now in Texas, and he's a hoot. But anyways, he knew his stuff. I I was like, hey, you want to come work over here? I mean, I know you're retired, but he knew these plans really, really well, especially Companion Care. He said, so basically, Companion Care is it covers what Medicare doesn't cover. If it's not a covered service through Medicare, it's not going to cover it, right? Yeah, right. So I'm going to spend a hint of more time there because it works different than the others. The others are HMOs. If you're used to HMO settings, HMO, your medical group makes all your decisions. They give you added benefits, and I'll go into those a little bit. But those two are HMO-based. But your other option is Companion Care. These options are, again, I said that they're for Medicare-eligible retirees that the district doesn't pay benefit. But if any of you want to use this, especially those of you that are Kaiser retirees that want to stay with Kaiser, the Kaiser Senior Advantage is a plan that would be available to you. So this is why I have these two paragraphs where I'm going to be really good about trying not to confuse you. So we're talking about individual, what we call our IRP plans. If you are district paid, you can choose one of these and you would still have your zero copay VSP plan to the district that you could buy, or either one of the two new dental plans that I'm going to talk about available to you, okay? If you're not district paid, this is something that you're going to do on your own. You're going to pay the premiums for these plans. Unfortunately, on that case, because it's a different arrangement, it is a package. So because you have dental and vision through your district, these are your dental and vision plan options. You can choose to buy them or not. You can just have medical. But it's the VSP $20 copay plan or the Delta Dental PPO $1,500 and it has a $1,000 ortho benefit on it. Okay, hey, it can happen, right? Ortho at 65, why not? All right, So let me talk a little bit about these plans. So Kaiser Senior Advantage. So anybody turning 65, this pertains to you for Kaiser. For those of you that want to retire on a Kaiser plan, you do have to, with the IRPs, remember, they are Medicare eligible plans. You have to have Medicare A and B in order to enroll into these plans, okay? Kaiser, okay? Kaiser's Kaiser, still works like Kaiser. You will have a Part D prescription, which is automatic. It's all done in the background when you go to Senior Advantage, okay? It's a pretty good, rich plan. And we have a little bit of differences. There are many Kaiser Part D or Kaiser Senior Advantage plans available in terms of design. There are some out there, and I'll tell you what happened to one of my districts that only offers it to retirees if they want it on their own. So I had a teacher I had to really go to bat with because it involved CMS, who mistakenly enrolled into a Kaiser Senior Advantage plan thinking she was enrolling into the SISC one. And unfortunately, she was having a bad medical year with a lot of labs. And, luckily, she was talking to one of her fellow retirees, and she was talking about all her out-of-pocket lab costs that she was having with this, with her Medicare Senior Advantage plan. And her friend said, wait, we don't have out-of-pocket costs for labs with our Senior Advantage plan. And then boom, the light hit, discovered she was on the wrong plan. We got her switched over, which we normally wouldn't do, but we made an exception because she seemed really sincere, and she just pulled my heartstrings just right. So anyways, I got it worked out. But be careful. Especially if you're just turning 65, if your mail is up this high from the floor up, then yeah, you're there. You know what I'm talking about. You are a commodity. Everybody, not just Kaiser, wants you to enroll into their plans. Be very careful. With any of our plans, including the AGWIP plans, when you enroll into this plan, you're not having to buy a separate Part D. We automatically enroll you into it. So your premium includes your Part D, okay? Here we go. So for the Kaiser plan, it's $229 a month for the premium on this plan. But remember, this is just the premium for the plan. You still have to pay your Medicare Part B, as in boy, okay? So keep that in mind. Out-of-pocket maximums, right there, there's no deductible. There is no lifetime maximum, so if you live to be 105, doesn't matter. Hey, if you're running marathons at 105, I really admire you. I know you're never going to reach that lifetime maximum. All right, office visits, $10 copay for office visits. Oh, there's that lab and x-ray I was talking about. Zero cost to you for labs and x-rays. Outpatient surgeries, $10 per procedure. Hospitalization services, no charge. Emergency services is a $50 per visit. Ambulance services, $50 per visit. Prescriptions, generics are $10 for up to a 100-day supply. Brands, which include specialty, are $20 up to a 100-day supply. Durable medical equipment, no charge to you for that. Eyewear, every 24 months, you do get a $150 allowance towards eyewear on this plan. Home health care, whether it be part-time or intermittent, no charge. Skilled nursing facility care, no charge. You do have a 100-day maximum per calendar year. And then you also have something called Silver and Fit. For those of you that are gym goers, you get Silver and Fit as an added value benefit, and it's also available to you at no charge. It's a network of physicians, okay? Of gyms, sorry. Oh, there it is, Silver and Fit, okay? That is available to you at a zero cost. It's part of your benefit, whether you use it or not. The Blue Shield 65 Plus, again, it's just a little hint difference than your district Blue Shield plan, but it's an option to you if you choose to enroll into this one versus the other one. This has been a really good one for those, again, that have district paid because, as you'll see, the cost is quite different between the two. Covers both parts of A of hospital and Part B of medical insurance because remember, with an HMO, there's Part A, there's Part B, and then there's Part D. These all fall under that Part C category, meaning that they get a certain amount of capitation for you from Medicare, and then they take care of everything. So in most cases of an HMO, like Kaiser and like this plan, they add extra things. They might add chiropractic services. Every plan is different, but they add added services to your benefit because they manage your care, okay? So again, it works as an HMO. You are automatically, again, enrolled into Part D, as I mentioned before. You have reasonable and predictable co-payments, which I'm going to go to in a second. Affordable monthly premiums with network flexibility. Blue Shield is a nonprofit corporation, so they don't answer to state shareholders, but to members. And Blue Shield is based in California, Because it's an HMO, you do have to live in the area to have this benefit, along with Kaiser. Let me also give you another tip, especially for those of you, if you're thinking of moving to like East San Diego, like the north, like certain parts of the county of San Diego, Kaiser Senior Advantage is no longer available because they don't have the supporting network for the 65 plus. The requirements by CMS for the 65 plus groups is different than the actives. And that happened to a couple of my district members. So just keep that in mind. Be aware of your service area. That's the only one I've ran into with Kaiser. But for Blue Shield, I know the map's horrible, and I apologize. It's very fuzzy, but it does list the counties or the areas where Blue Shield is available to you, especially if you're planning to move. It is available here. You're in the metro of one of the great areas of HMO coverage areas. Horrible map, sorry, it's very, very fuzzy. I'm trying to get a clean copy, haven't been successful. Counties where you have access to this HMO product, very important. Stay in your service area. Here we go. The premium, it actually went down $5 this year. It's $265 per month. And again, remember, you still have your Part B, as in boy, premium on top of that. There is no deductible. The out-of-pocket maximum is $1,500. Primary care office visits, $20 per visit. Inpatient hospital care, 0 copay per admission. Outpatient surgery, 0 copay per visit. Basic outpatient diagnostic tests, another 0 copay. Ambulance services, 0 copay per trip. Durable medical equipment, 0 copay. Emergency room copay of $50. Skilled nursing facility, 0 copay. Again, you do have a limit of 100 days per calendar year. Generic prescription drugs, $10 for retail, $20 for mail order. And the preferred brand prescription drugs are $30 retail and $60 mail order. The difference is that retail is 30-day, mail orders 90 days, okay? Non-preferred brand prescriptions, so they do actually have a third level on the prescription. This prescription, by the way, I should have added, just like Kaiser's is managed by Kaiser, Blue Shield under this IRP is managed by Blue Shield, okay? So they have a third tier, which is $50 for retail and $100 for mail order, okay? Resources to keep you healthy, routine care. Blue Shield, of course, encourages you to maintain a relationship with your providers. There is the Nurse Help 24/7 line that you have access to, because under the IRP, the MD Live won't be available to you. This is what you get with your IRPs, okay? Life referrals 24/7, get convenient support from counselors ready to assist you with personal, child, and elder care. Daily challenge, every day you'll get an email to perform one simple wellness-related task. That's fun to do. They do that to kind of keep you engaged. It's kind of a good way of self-checking yourself, so just an added benefit that they provide. They do have health management programs to help you get practical resources and support. And they also have QuitNet, okay? So you're retired now, you should have no more Mt SAC stress, so the smoking needs to go. No, I'm just kidding. I'm kidding. Anthem Blue Cross Companion Care. So just to kind of clarify, I mean, these are separate IRPs, so companion care is administered through Anthem Blue Cross. Here are the benefits. So this companion care works more like a PPO, or a Medicare supplement, okay? So if you are planning to move out of California because you're tired of our taxes and our gas prices, and you want to stay on a district plan, other than the district 100% plan, those go over the borders too. But remember, HMO base has to stay in the service area. But with this plan, you can also, just like the PPO plans, you can go outside of the state. Anthem Companion Care allows members to see any doctor, hospital, or specialist that accepts Medicare assignment. Okay, a lot of doctors do. Okay, and but that's if you're wondering about the network, that's the network. If they accept Medicare assignment, they're in. So if you find a new doctor, just call them and say, hey, do you accept Medicare assignment? If they do, they'll take companion care. No referrals are needed, because remember, this is not a HMO base. This is more of a PPO base. You have the freedom to go where you want. It does require members to have, again, Medicare Part A and B. We automatically enroll you, just like the other plans, into Part D. So this premium that I'm going to show you includes your Part D. Monthly premium will not increase with age, okay? So you don't get penalized for being older. Yay. All right, just kind of inform you, we do require, not only with this one, but any of our IRPs, 45-day notice because they are tied to Medicare and CMS requires that. We have to have, so if you're planning to retire in say March of next year and you want one of these, you need to make sure and get that into your district, not 45 days, more like 60 days because the 45-day limit is SISC's limit, okay? We can still get it in, but prefer that you stay with that date. So don't be afraid if you missed it because you were on a great vacation in the Caribbean and you lost track of time. All right, so Medicare will serve as your primary with this plan, and it's called companion care for a reason. It's a companion to Medicare, okay? Members so you have, with this plan, because it does have that Part D formulary, you do fall under the IRMA guidelines. This is federal, this is not SISC. This would be with anybody that has Medicare. IRMA stands for Income Related Monthly Adjustment. So if you're one of those that makes, oh gosh, I always get dangerous here, over $85,001 to $107,000, you have to pay an extra like $12 and something cents a month. So, yeah. If it's on the medical, it's a little more, but that's, so if you make under $85,000 a year as a retiree, that's how that IRMA is based. Now remember, with Medicare, this is an added Medicare thing from my Medicare 101 presentations. It's a 2-year look back. So so if you were enrolling now, they would be looking at your income from your 2017 tax year, okay? So like my friend Maria Harlan says, 2 years before I retire, I'm gonna go work for Walmart, anyways. Loss of any part of Medicare will result in a loss of all coverage, unfortunately, because remember, these are Medicare plans. You have to have Medicare A and B. No coverage for non-Medicare covered claims. So what that means is if you are gonna, because unlike the HMOs that cover some services that aren't covered by Medicare because they chose to add them on as part of your package, this one works straight with Medicare. And I'm gonna show you a chart here in a second. So here's the way, when people ask me, what does companion care cover or not cover? Whatever Medicare covers, companion will cover. Because remember, Medicare doesn't pay 100% of services. They pay, anybody know what that percentage is? 80%, good job. 80% on average is what they pay. So companion care pays the difference of what Medicare does not cover. If Medicare doesn't cover it, let me give you an example. Medicare is really specific too. Spinal manipulation. Fancy word for one of the services that chiropractic services offers, right? But they won't say chiropractic services because some chiropractic services include massage. They're not going to cover massage. They're not going to cover any kind of other therapy that's related to spinal manipulation. So they'll cover spinal manipulation, but nothing else. So if it's covered by Medicare, companion care will cover it, okay? When in doubt, you can call Anthem Blue Cross, and they can assist you with that. Or you can also call Medicare. If you have a list of Medicare covered services, if it's on that list, they're going to cover the difference. Companion care is. Monthly cost though for that freedom, $386 a month in addition to your Part B. Here's what you get. Whoops. Whoa. Stop. Okay. Everybody know that Part A is what? Hospitals, good job. Hospitals. Part A is your hospitalizations. So what I've done is the first column is your Medicare, what Medicare covers. The second column is what companion care would cover. So if you go into the hospital, if you're admitted into the hospital, Medicare pays all but $1,364 for your first 60 days. So if you didn't have a supplement at all, that's what you would be responsible if you were in the hospital for 60 days or less. Well, companion care will pay that. So you leave the hospital at a zero cost out of pocket. If you're in there for 61 to 90 days, Medicare will pay all but $341 a day. That can add up to quite a bit of money, right? Companion care will pay that for you. It kind of goes on with the list. So lifetime, there is a lifetime, reserve with Medicare. So companion care will pay 100% after Medicare and lifetime reserve are exhausted up to 365 days per lifetime. So in addition to the Medicare reserve, you get an extra 365 days of coverage with companion care, okay? I pray none of us ever have to use it, but it is available. Skilled nursing facility pays 100% for the first 20 days. So companion care pays what? Nothing. Because they covered it all, right? So it's companion care. However, from the 21st to that 100-day calendar limit, though, they pay all but $170.50 per day. Companion care will pay that, okay? Deductible for Part B is there. I don't know if any of you knew that, especially if you don't have it. If you've never had a supplemental and you've got Part B, you've had to pay that deductible every year. With companion care, you don't have to pay it. It pays it for you, okay? Going on to the second page. Basics of Part B, which is your medical, right? All your other services that are non-hospital based. Medicare as a whole pays 80% of those services. Companion care will pay the other 20%. Doctors, x-rays, and ambulance, 80% of Medicare charges. Companion care will pay the difference. Lab is covered at 100%, so companion care pays nothing. Physical speech therapy, 80% by Medicare. Companion care pays that difference. For blood, Part B, 80% of coverage for Medicare after 3 pints. The first 3 pints are unreplaced blood, and it pays that 20%. So companion care is making up what, again, Medicare doesn't cover. One more page, because this plan does work a little differently. So for travel coverage, so for those of you that are getting ready to go on that Caribbean cruise and you're thinking if this plan might be an option, Medicare doesn't have a benefit for out-of-country travel. You have to stay within the U.S. to be covered unless, of course, it's an emergency or urgent care service. But with companion care, it does pay 80% of inpatient hospitalizations, surgery, anesthesiologists, and hospital visits for medically necessary services for 90 days of treatment for lifetime, okay? So don't get sick when you're traveling, okay? Please. Just kidding. Call Anthem for any additional details. You also have the Silver and Fit available to you. I didn't mention it with Kaiser, but with Kaiser, you also have Silver and Fit under these plans. Under the Medicare benefit for Silver and Fit, it's not a benefit, but we don't charge for it, and it is available to you. Prescriptions are handled, of course, in accordance with the Pharmacy Part D benefit. There are a few little exclusions. I kind of put them there in red. Due to Medicare restrictions, the following programs are not available with companion care, and that's the zero generic copay at Costco. You can get them covered at Costco, but not for zero cost. And the diabetic supplies for a generic copay. Okay, that's not available. They're available, but you have to pay the brand copay. Okay, what is that copay? Oh, I didn't put it on here. It's $9 for generics and $35 for brand. Why didn't I put it on here? Yeah. Oh, there it is. It's there. $9 generic. Sorry, I'm blind. $35 brand. 90-day supply is $18 and for generics and $90 for brand. Okay. So, retirees again, is there coverage for your dependents? Kaiser Senior Advantage accommodates coverage for members over and under age 65. For your Blue Shield Senior Advantage plan, an individual, because it's like an individual enrollment, the spouse and the domestic partner have to be enrolled in Medicare Parts A and B. They would be eligible to enroll on their own contract, and we are able to do that for you. It may be that if you have like a child, because you're one of those retirees, started life again, or wanted to have a second one, we can do that split contract. We have a way that we can enroll your dependent. Companion care, again, also a Medicare Advantage plan. Parts A and B would be required in order to be eligible to enroll. Okay. All right, oops. Let me stop here because I know most of it's going to be medical. So I want to pause before we go to dental vision. Or question? Am I going over time? Yeah, you're good. Okay. Okay. Do you feel like you're at The Price is Right? Yeah, on The Price is Right? Yeah, it's like, you're the next contestant on The Price is Right.
Okay, because most of this is mostly probably medical questions, I wanted to address a few questions that we have out there first, and some kind of cleanup pieces. Yes. One, for those who missed the beginning of the recording that is being online right now, we are working to make sure that the full video is posted later. So for those that are listening to me from a different state or different city far, far away, We will have the full video up and running as soon as possible so you can capture the first part of the video. Second is CalPERS is still sending communication to everyone saying that open enrollment is happening, please make your choices. It's very easy for me to just say ignore all of that because it doesn't pertain to you. But we do know that CalPERS is still sending information. They're sending it to not only active employees but to retirees as well for them to make changes during open enrollment. So we just want to let you know that you're not going to be covered under CalPERS effective January 1st. It will be through SISC should you make an election. So we want to make that perfectly clear because I know it's somewhat confusing with getting information from both us and CalPERS at the same time. If you are looking to turn in your forms after this, you can do that with myself or Stacy outside. We will be happy to accept the forms. And then, are we going to go over proof of eligibility?
I can, if you want me to.
Yeah.
I didn't have it, but yeah.
Okay, then I won't, I'll let him address that. And then I think that's good. So I just wanted to make sure we were clear on some of those little nuances. And then I'll leave it back up to you so we can kind of address some medical issues. And Zach, I believe, and myself will be running microphones so that everyone can listen to the questions as well.
Yeah, sounds good. All right, here we go. We have a question right there. There was another one, hand up. Okay, there's 2 hands there in that same area. 3 hands, 4.
Hi.
Hi.
I was wondering if we sign up for Plan 100A, should we also sign up for the supplemental plan too for $283 or $386 a month?
Oh, okay. That's a great question. So because of Medicare guidelines, number one, I don't think you would need it because that's a really rich plan. But Medicare guidelines do not allow any Medicare eligible retiree to enroll in more than one Part D plan. And I'm so glad you asked that question because it's going to lead me to a little educational piece. Because you're a commodity, you're going to get great deals in the mail that promise you the sky, the world, the stars. Remember, especially after, even if you're with CalPERS now, if you're a CalPERS member now, if you sign up for something else, Part D wise, it will disenroll you from what you have now. That's a CMS federal guideline about Medicare when it comes to Medicare Part D. So you can't enroll. My short answer is unfortunately you can't enroll in more than one in more than one plan on your own. You can only be on one Part D at a time. And so when you turn in a new enrollment, it pushes the other one out. Okay. So be very, very careful with those marketing pieces. So that 100A is such a rich plan. Even though you're not eligible for it, you would be overspending money, I think, in getting both. But it's a great question.
So if you sign up for A, you're covered for all of the, it was sounding like the IRA was like an end-of-life kind of a plan, like a term, no?
Correct me if I'm wrong, but the IRA is only if you need to purchase a plan and the district isn't going to be paying that plan.
The IRP.
The IRP.
Right, IRP, yeah.
Yeah.
Okay, here's the deal. We set them up to where if you prefer one of those, or let me give you another case. Let's say you're going to get the A because the district covers you, but you can't afford I don't even know what the premium is off the top of my head, but I know it's a lot of money, and you might want to put your spouse under one of these IRPs. You can do that.
Does that make sense? Okay.
Okay.
Yeah, it's basically anybody who retired post 1996 where your spouse is not covered under a supplemental plan, you can then pay for one of those IRP plans for your spouse.
Or if you won the lottery and you want to buy that second 100A for her, you can do that.
Yeah.
Yes, ma'am.
But if you retired from Mt SAC with the medical benefit, then Mount San Antonio College is paying for that premium. So it will be zero cost to you.
Right.
Okay, this might sound a little bit naive, but nowhere did I see where EQIP is spelled out.
Oh, where AGWIP is what? I'm sorry?
Oh,
the AGWIP? Right.
What is that?
That is that Part D formulary that I was talking about when every time I kept mentioning the Medicare eligible plans, PPO plans with the AGWIP pharmacy benefit. So what it is, AGWIP stands for Employer Group Waiver Plan. It is a Part D formulary that's partially, that basically what it is it's a Part D formulary that makes the benefit really more accessible and more generous for those retirees, because that's typically what retirees need the most of, is their medications. So the formulary is a little more expansive, so there's more drugs on it that are available to them. They get to get the free generics at any retailer, not just Costco. But they do have to have Medicare A and B, and so that's the formulary that's attached to their PPO 100A or 100G plans.
Okay, and I have one more question.
Sure.
On the website, does it spell out what the co-pays are for the companion care plan?
For the
Like for
companion care,
office visits and,
it was on one of the slides, or were you wanting like some more detail, maybe?
no,
Oh, I see what you're saying. Okay, so remember with companion care, it's not necessarily a copay. It's really for your office visits. You're not going to be, sorry. For your office visits, it's basically just the percentage of charges, which you're paying nothing. You won't be paying anything. Because if Medicare covers 80 and that office visit's a $100 visit and it covers 80%, companion care is going to pay the difference. So you're paying nothing for your office visits. And thank you for pointing that. I would never even thought to say that. I just, I kind of assumed that. So your questions were great. And I believe, folks, there is no such thing as a naive question. I really mean that. She used the word naive. I used other words. No such thing. I want to hear them all. I want you to feel comfortable. This is a change for you. And I know change is hard and different. And I promise you, we have, we're celebrating our 40th year in business, and we only do school district employees. So your district has gone with a really great pool. And I'm not just saying because I work for them, because I actually came with 23 years of healthcare experience, both on the administrative side of clinics, and also I also worked for Anthem Blue Cross and for HealthNet prior to coming to SISC. And let me tell you, what is being offered to you are some great benefits, and the costs compared to what's out there in the commercial world are just incredibly good. So I hope I can build that confidence in you that your district's providing you some great products. So I want you to ask your questions, please. I want you to leave comfortably from here, and once you're sold, we don't go away. We're still here, So, anyways, question?
I have a question. I'm currently on Kaiser Senior Advantage plan, and I noticed there was no comparison matrix for the SISC plan. Does that mean it is identical, or is there no comparison matrix because there is no choice to stay with CalPERS?
Oh, I see what you're saying. Right, there's no choice to stay with CalPERS. You'd have to switch. Are you under 65 retiree?
I'm over.
Over 65.
I'm A and B.
So you could. So your plan would be the Kaiser Senior Advantage plan that I went over.
Identical to what I have now. That's what I need to see. I see no comparison matrix.
Right. It's not. I'd have to look at it. I'll be happy to compare it for you, I'll tell you what. I will give you my email. If you want to send me that Kaiser plan, I will create a side-by-side comparison of it and share it with the district.
For making any choice, that's what we need is a matrix to say, here's what you gain, here's what you lose. I can't make that decision until I see that.
Right.
We currently do not have a side-by-side comparison for the over age 65 supplemental plans to the SISC supplemental plans. So we can work to get that posted on our website so that's accessible to everyone and have that available.
Yeah, I'll make it a priority and try to get it to you by Friday. If maybe you, Alexis, just send me over, if you have it, their summary, and I'll create one for you. I'll be happy to. Yeah, absolutely. It's never been asked. Folks, and I say this with all sincerity because I have to face you later. I'm not going to lie to you, okay? So I'm here to stay. I'm going to retire from my school district, so I'm not going anywhere. Our IRPs are the quietest benefit we have. We hear nothing. So when that right there tells me, we have two people that pretty much manage our IRP desk for questions. That tells me that it's pretty seamless. We hear almost no feedback from those plans, none. Kaiser Senior Advantage, Blue Shield 65 Plus, Companion Care, hardly ever, never, ever hear anything from them, ever. So that tells me they're working. It's a good thing. So
I have a follow-up also.
Yes, sir.
You mentioned Cairo Riders and MD Live. You didn't say if that applies if you have Kaiser. MD Live sounds like a really good possibility.
Right.
Does that exist with Kaiser?
Yeah, actually, if everyone wants to grab this flyer that I have in the back, a lot of these added value services are there. To the right of each one of them is a little box that will tell you if it's for Kaiser only, if it's Blue Shield HMO and PPO, or Anthem HMO and PPO. So those are on here. In answer to your question, because Kaiser is Kaiser, we have to use their call-in line. We can't offer MD Live. Yeah.
Armando, I do have, hi. Sorry. I do have a question here. My question is, does the PPO insurance cover medical vision exams? For example, if you need cataract surgery, would it cover it? PERS Care covered eye exams from an ophthalmologist, but not an optometrist. Is this the same under any new plan?
When it comes to eye care, here's the way to remember. If it's medically based, it's going to be covered by the medical plan. If it's for vision correction, contacts, glasses, that goes under your vision VSP plan. So when it comes to cataracts, those are covered under the PPO plan.
Medical plan.
Medical plan.
And then
or your HMO.
And then my second question, which I have, is there are current Kaiser plans through CalPERS that have a Delta Dental add-on to it, where they can receive Delta Care. Is that also applicable in the Senior Advantage Kaiser plan through SISC?
Okay, it's going to if you are direct bill, where you're paying for the premium because the district doesn't cover you, unfortunately, your only option is the PPO 1500 plan and the PPO $20 copay plan and the Delta Dental $1,500 plan with $1,000 ortho. That comes as a package. If you are a district paid retiree, then those plans wouldn't be available, but you have two PPO options. One is unlimited benefit, the other one is the PPO 1500, and they both have a $2,000 ortho benefit and the zero copay VSP vision plan, which is a really nice rich plan.
But those are not part of the Kaiser Senior Advantage option. It would be separate. They would have to purchase the dental and vision separate outside of what they would purchase.
Oh, I see what you're saying. Correct.
Yes.
As far as there is an exam that's covered under Kaiser. It's part of like they're just checking for the health of your eyes and what have you. But they're not going to they're not going to provide. They don't provide glass benefits or lens benefits, if I'm not mistaken. Yeah. So those additional plans through CalPERS, that doesn't sound like something that we offer. Yeah. Oh, yes.
I want to know, under this PPO plan, they have two plans here, 100G and 100A.
Mm-hmm.
I have a district-paid plan and Medicare, so how do I know which one it is?
Okay. The only difference with those plans, couple of main things. With that 100A, it's actually the richest because you have no deductible, and it's a 100% plan. The 100G has a $500 deductible. It's still a 100% plan, but you have to pay a $500 deductible. So I'm sure the district won't mind me saying that, but if it's district paid and I was you, ma'am, I would get the 100A because you have zero deductible and it's going to be paid for by the district. It'll be your richest benefit. As far as services, ma'am, they're the same plan. It's just differences. And then it's a $10 copay versus $20 copay.
Now we have copay, which we didn't have with PERS Care.
Oh, I see. Then you definitely want the A because it's only $10 for most of your general office visits. Yeah. I'm sorry?
Is companion care the same as supplemental?
Yes, it's a supplemental plan, correct. Yes. If you are a 65 plus retiree, right now is your chance if you want to get the 100A or the 100G. The only plan. Or if you want to get one of the individual retiree plans. That's correct. It's district paid. I mean, why not go for the best, right? If I'm not here, no, just kidding. Yeah.
Are you ready?
Yes, ma'am. Yes.
Okay. Can you tell me the advantage or disadvantage of companion care versus the 100A if I am on Medicare?
Oh, okay. The only disadvantage is with the companion care is if, remember, if it's a non-Medicare covered service, there would be no coverage for it. On the 100A, remember, it's a standalone plan on its own. So if something's not covered under Medicare at all, at least you've got your 100A or G to back you up now. And it could fall, as long as it falls in their medical policies as a standalone plan. And I'll give you an example. One of the retiree she was actually the president of the retiree group for Palomar. She was told by her doctor, that's where my story comes from, oh, it's a supplemental plan. They never pay for those labs. It was an additional cancer type of screening lab that Medicare doesn't cover. It would have been covered under her plan. I looked into it for her because I wanted to see. It would have been covered under her plan, but he just assumed her supplemental was just like a companion care. It just covers the difference of what Medicare covers. But because that plan is a standalone, its own policies plan, it may end up covering services that Medicare doesn't cover. Does that make sense? So that would be the advantage versus disadvantage of the two.
Thank you. Are they also the same as far as travel, out of the country travel?
Yes, you still get out of country traveling with the PPO plans for emergency and urgent care services. I always recommend, this is a travel tip for you, if you do, take a claims form with you, call Blue Shield to have them send you a claims form, or we can get you one. And take it with you, because if by chance you happen to have an emergency or an urgent care visit, give them that form so that they can fill in their information. Because in most cases out of the country, unless Blue Shield has a contract with an out-of-country provider, you will have to pay for the services and then bill or submit the claim to Blue Shield for reimbursement.
Okay, and my last question, and you probably said this already,
It's okay.
Medicare is primary.
Correct.
But that doesn't mean that if I did the 100A, it would only cover what Medicare didn't. It would cover whatever it does on its own.
That's correct.
Very good. Thank
That's
you very
correct.
much.
You're very welcome.
Yeah, I had a question about the payrolls.
I'm sorry, who's, oh, there you are, sir. Sorry about, what was that?
I currently have a dependent covered, and they're deducting it from my CalPERS pension. Now, if we go off CalPERS, how does my dependent get paid, or how do I pay for that coverage?
That's a Zach or Alexis question. Yeah, Alexis, if a district paid member has a spouse whose premium is being taken out by CalPERS now, how would that change coming to SISC?
So they are currently a retiree covered by the district, but enrolled in a two-party plan where they have to pay CalPERS.
It's a three-party
And it's being
plan.
deducted automatically through the pension.
It's a three-party plan.
Okay, so three-party plan.
Right.
And it would be deducted automatically through your pension with CalPERS.
Correct.
So what would happen is that we, as the district, would bill you directly for the difference between what you're covered by from the district and the difference of that additional cost for a family plan. And we would work with you directly to reimburse the district for the cost.
Okay, so how do I set that up?
We are working with fiscal services to get that set up. The first week of November, we will send communication to everyone who would be impacted by that. giving them step-by-step instructions on how to set that up with fiscal. It'll either be a direct deposit option, or you can write a check, or we can do an ACH transfer.
Okay, so you're saying in November I'll receive something from?
In November, yes, we're gonna send communication to everyone who would be affected by that type of enrollment, who would need to reimburse the district for the cost of the full party.
Great, thank you.
Yes.
What is the notion that we have all been reading that says that if we don't sign up for anything, that we lose all of our medical benefits or all of our benefits? I thought that we were contractually obligated to get those lifetime medical benefits.
I guess maybe my question would be, if it's paid by the district, would there be a reason you wouldn't want to enroll? Or is it coordination of benefit issue? Is it a, you know?
There are a lot of retirees who may not have gotten this information, who may not read their district email
Yeah,
anymore, who have
right.
not put in a change of address.
Right. Those we have an exception for. I've actually talked to Alexis about this because I totally get that. I've dealt with districts where retirees have been gone 20 plus years, same kind of scenario. We will retro enroll them once because what typically happens, unfortunately, is they'll go to get care and it gets denied, or their coverage gets denied, and then that's when we'll hear from a family member or a caretaker, and we've arranged that we will retro enroll them so that they've got their coverage, and we will retro enroll them so that their services are covered. Yes, well, yeah, of course. We do that with all of our incoming districts because we recognize that with retirees that happens. The great part is that with the PPO plans, because we are self-insured, we have a lot more flexibility with our PPO plans, so we can enroll them from the very beginning. Yeah. And it's being recorded. You're gonna have a recording. So.
Right up here, and then it'll go.
Yes, sir. It's being recorded as we speak. Next question, please. Oh.
Yes, I'm moving out of state,
Uh-huh.
so obviously it would be the PPO, which I'm on now.
Great.
There's still in-network doctors, even with the PPO.
Yes.
How do I get a list of that, of those doctors, hospitals, where I'm going?
If you
Most
go,
doctors are on it, but I'd
sure,
like to know the in-network.
sure. If you go to the Blue Shield website that I gave on the link on the presentation, you can look up by area, like by your zip code, by your, and then you can say a 50-mile radius, 20-mile radius, and look up physicians, hospitals, medical groups, et cetera.
Well, when the benefits department gave me links, it didn't work that way. You'd go there and it wanted your member ID number. And of course, there's no member ID number because
Oh,
we
no.
haven't signed up.
Yeah.
So
You
that's a
don't-
real problem.
Yeah, you don't need ignore the box. You don't need a member ID to do a search.
It wouldn't give it to me.
Okay.
It's the same link, is the one that, surfaced.
Right after this meeting, I have my computer and I can walk you through it.
Awesome. Thank you, Zach. Appreciate that. Yeah, and if you're having problems like that with the website, please let us know because we want to make sure that, and our carriers maintain those for us. So if there's issues, we want to definitely address them. And I apologize that you've had some problems with that. Yeah. Yes, I'm sorry. That is correct. Right.
What was the question?
The mail order 90-day is through Costco. It's mail order, period, yes. Except for the AGWIP plan members that have the Part D, they can get 90 days retail at any pharmacy, yeah.
I had a question between
Yes, ma'am.
the HMO and the 100A.
Okay,
Okay, so we usually do the HMOs because of the cost, like you said. But if we do the 100A, pretty much we're getting everything free or zero deductible. And if the district is paying, like you said, we're better off going with that, correct? Because we
That's
have more
cor-
flexibility.
that's right, ma'am. And you even have if by chance you have to pay for anything, the most you would pay on your worst medical year would be $1,000 individually. And if it's a party of two, it would be $2,000 for the year. So I hate using this example, but let's say you get in a horrible accident and you're both, in a hospital for about 2 months. It could be millions, but your out-of-pocket maximum would be $2,000 for the calendar year.
And so speaking on behalf of CCA 262, because I'm the treasurer and I was on negotiations for that, we specifically negotiated that plan into our contract. So it's written into our contract for our retirees because it is the most richest plan that you can have. So, yes. So we would encourage that.
Yeah, especially if you're going to be out of state, it's a great plan to have. I mean, 0 deductible, and you're only paying office co-pays of $10 when you have to go to the doctor.
Currently, my husband is covered by his former employer. If anything were to happen where he's no longer covered, I could enroll him at a later time.
Absolutely.
All right.
Yeah, loss of coverage would be what's called a qualifying event, and so even mid-year you could enroll him.
Oh, that's
Yep.
great. That's
Yep.
great. Thank you.
You're welcome. Oh, back in the back, Zach.
Great.
Okay, you're saying that the office visit for the 100A over 65 is a $10 copay? On the paper, it says 0.
It's a $0 deductible, and oh, wait a minute, it's the 100A with the $0 copay. I apologize. We have a $10 copay one too, so that's probably where I got myself confused. Yeah, it's 0.
Thank you.
Yeah, you've got this is the richest plan that we offer right now. So.
Yes, I was going to
Yes.
ask you,
Wait.
I'm plus
okay.
65 right now, and when we sign up into this Kaiser plan, my wife, under 65, she's still covered by the district. How would we go into that transition into getting signed up for the new system now? How would that work?
You would enroll through the district office. Is that what you mean, like enrollment, the initial enrollment for her? Yeah. Right now is open enrollment, so you can add dependents. Right. Right now is your time to be able to add dependents, change dependents. So you've got that open enrollment period through. When does open enrollment end for you, Alexis? Or Zach?
For those, depending on what group you fall in, if you're over the age of 65, it does end October 15th. For those under age 65, it is October 31st. Sorry.
Did that answer your question, sir? Oh, okay. Okay, I have to go back to something I answered. So,
Wait.
oh, I'm sorry. I need to correct something I said. The 108 $10 plan is a $10 office visit copay plan. It's 0% responsibility for those things that require you to meet a deductible because there's no deductible. So, but if it's an office visit, it is a $10 copay.
Okay, quick question, clarification on if you go for the dental and the vision, the payment, wherever it's coming out of, is that a 12-month, it goes for 12 months, not 10 months?
For a retiree, it would be monthly, correct?
For 12 months?
Correct.
Yeah, not like a regular employee where we used to stop.
Right, where it's 10 months, right.
Okay.
Right.
Just wanted to make that clear.
Sure. Great question.
Okay, so a few more questions have been asked about. I've been getting text messages, emails, voicemails. We have about almost 40 people accessing this live as well. So we're getting questions regarding that. So a few things. One, if you are under the age of 65 and you are enrolling in a plan, so it would be the same plans eligible for active employees, you complete the SISC 3 enrollment form.
Correct.
So, yeah, it says on top, it says SISC 3 enrollment, and then in parentheses, do not use for Kaiser.
Yeah.
So you would also complete that form. This is something separate. If you're over the age of 65, you would also complete that form to enroll in a dental or vision plan. If you are over the age of 65 and you are electing one of the three supplemental, the Kaiser Senior Advantage, the Blue Shield 65 Plus, or the Companion Care, you have your own forms for those. And then there is a SISC Companion Care PPO Egg Whip form for those that are enrolling in the 100A or the 100G plan. So if you are over the age of 65, you have very unique forms for the particular plan that you are enrolling in. And if you're choosing over the age of 65 to enroll in a dental or vision plan, you would need to complete the additional SISC 3 enrollment form, in parentheses, do not use for Kaiser, so that we can have all of the forms necessary to enroll you in medical, dental, or vision, depending on what you choose. So the egg whip form is 4 pages. It's not 4 pages of information that you have to complete. It's really 2 pages and then a bunch of signatures, like confirming that you verify the above information is true and correct. You're agreeing to the terms and conditions of the plan, things of that nature.
Right. Because it's an AGWIP plan, those questions, unfortunately, and those signatures are required by CMS for us to do that enrollment.
The SISC 3 enrollment form, for those of you who are under the age of 65 enrolling in a plan, or those over the age of 65 enrolling in a dental or vision plan, the SISC 3 enrollment form is 1 page. It's very busy. It's kind of drab looking. No offense, Armando.
No, it's fine.
But it's a very busy form. That is the form that you would enroll. The second piece is for those of you who are retired from the district and have chosen to not enroll in a district-provided plan because for some amazing purpose you are covered under a spouse, under a different plan, and if you've chosen not to be enrolled, you need to enroll this year in order to lock in your enrollment for SISC. You can enroll in a single party if you're covered and paid for by the district. It's nothing out of your pocket, and the good thing is you will be double covered. But we want to ensure that you still have this opportunity to enroll into the SISC plan, so it's very important. Another piece is which I'm going to defer this to Armando, but I want to offer up the opening to talk about it, is if you are over 65 and your spouse is under 65, or if you are under 65 and your spouse is over 65, there are some fun nuances to how you would enroll in the plans that are available to you, because what's available to you over the age of 65 is not the same that's available to your spouse who is under 65, or vice versa. So Armando, take it away from there.
Okay. So what we call a split contract, when one is in an over age 65 enrollment and another one's in an under 65. It's an exception that we wanted to make for your district because we know that everybody's situations are different. Not everybody could afford to pay. For example, I'm over 65, my wife is over 65, but the district's paying for mine, but I can't afford to pay the premium for another 100A for her. But, maybe companion care might be another option that I can do. So that's a split contract. She's on companion care, I'm on the 100A, plan, vice versa. So it's called a split contract, and we do it so that you can have the option of either both being under an IRP or one in one, one in the other, or both in 100A plans. So
another thing, just really fast. Another thing that I want to clarify is there are a few changes from the CalPERS covered dependents versus SISC. So this question did come through. If you are a legal guardian of a dependent who is over the age of 19, SISC follows the IRS dependent eligibility guidelines. CalPERS has exceptions just because they're CalPERS. But what it is that if they're over the age of 18 or over, they are not covered as a legal dependent. So in terms of being their legal guardian. We are working together as the district to figure out what options we can offer those that had coverage and no longer have coverage, because we do know that this is a change. And then additionally, if you are enrolling your spouse in the benefit, we do require that we see your most recent 2018 filed tax return with your spouse listed as your spouse.
And we only need the front cover, a copy of the front cover, and you can blot out your income.
Yeah, we don't need your financials.
Yeah. We just need to see that you filed together. That's all we need for proof of spouse.
Correct. And then birth certificates for children if you
Yes.
are adding on children.
I just want to clarify something here. The district is paying for the health only for a retired person, not the dental and the vision that's being offered?
That is correct. So this is the first year that, this is our first opportunity that the district is able to offer a group plan to retirees for dental and vision. But the contracts and agreement with you and any retirees and active employees is that the coverage is for supplemental coverage, assuming that you will be enrolled in Part B. So the relationship that you have with the district and what the district is paying for your coverage does not change. So what was available to you through CalPERS in terms of what we covered, whether it's single party or two party, that is the same relationship that will carry over into SISC enrollment. We will continue to pay for the premiums for either a single party or two party coverage, whichever one you qualify for. You want this? That is not incorrect. So the question is, and Armando, you can answer it. What happens if a retiree does not enroll in medical, dental, or vision this year?
As I mentioned, we have situations with retirees that we lose track of them, either because they're no longer able to, make their own contacts or, whatever the case may be. When it comes to the medical, we will retro enroll them to the beginning of the year. However, when it comes to dental vision, it's your opportunity to enroll now because it's open enrollment and available. And so for the dental and vision, it's like this is your opportunity, and if you miss it, then unfortunately it won't happen. Now, I'd have to talk to my coordinator, but I would like to, if the same thing would happen, if again, I can't promise this, but I would look and see if I can retro enroll dental vision in a case retiree where we never found them. Is that what you meant? Oh, for future years. Right. It's always been our guidelines that retirees that leave our plan, unfortunately, cannot come back. It's our policy that we have always maintained. It's our eligibility and enrollment rule. But it's if you are a district paid retiree, like I said, enroll. You're not paying for it.
No. For dental and vision, they would be paying
Oh,
for
dental
it,
and vision,
and
yes.
that's what we're
Yes,
talking
dental
about.
and vision, yes. Right. I'm sorry, I apologize. Yeah, I was going to medical again.
So to
Dental and
clarify-
vision, yeah, once you're out, unfortunately, it's your opportunity to enroll into it now.
So, to clarify, if you want to enroll in dental and vision, this is the only year you can do it. You're not going to be offered, as of right now, any other time in the future to do it.
Correct.
Okay.
Can you enroll in dental only and not vision, or vice versa?
Yes, because you're paying for it, so. Yeah, but you got it, right.
So if you enroll for dental and vision this year and you decide the following year you don't want to do that, that's not going to be a problem, right?
You could do that,
And
yes, but
that'll
then
be like for-
unfortunately.
that'll be like for the, and I'm asking because somebody asked me to ask. So if she decided she's going to sign up for 6 months, sign up, and then after 6 months she decided she's not interested in, does it have to be like for the whole year, and then the following year she makes?
Actually, if she signed up for it, open enrollment will be next summer for the district, so she could actually drop it then.
Next time, oh.
Yeah,
20,
it's
2020.
open enrollment is when she could drop it.
Okay.
Yeah,
All right, thank you.
you're welcome.
Armando, hi. Could you speak to, for those retirees who may be under a specific treatment regimen on their current plan and then will be making a transition to another plan, how that will, what that process will look like for them?
Absolutely. So the easiest thing to do would be to call Blue Shield, let them know that you are, two ways. HMO, you could do it through your medical group. Let them know that you're going to be switching plans, provide them your new card, and then they can do the authorization process on their own. On the PPO side, you can call Blue Shield directly and let them know that you are transitioning that you're in the middle of treatment and you want to continue, in that treatment process. The great part is that if you're with Blue Shield and in an HMO and you're with the same medical group, it's literally a very easy transition. But if you're, say, on an Anthem PPO plan, then you definitely need to contact Blue Shield so that they could do all of the transfer contract information, including reviewing what treatment that you're on so that your continuity of care can continue effective 1/1.
Okay.
And I think, Asia, did you bring your handouts? Asia also has some really good handouts on that, if you are interested in that.
We have another question down here, but then I'm going to have a question for Alexis. So.
Yes, on the split contract situation, what additional paperwork do we have to fill out, number one? And number two, is the sign-up deadline the 15th or the 31st of October?
Okay. We gave you wiggle room, is what happened. So we said October 1st, to get everybody kind of on board because that is what we wanted. But I went to our pharmacy person because what it is the 15th is the deadline because we have to fulfill CMS's timeline. And so we had a little wiggle room. So that's why now we're saying the 15th. But the difference is depending on which plan and how your situation is as far as district paid versus direct paid. But if you are so here's another way to describe the forms. If you're going to be on that 100A or 100G, and you're going to and you're a Medicare eligible retiree, there is an AGWIP enrollment form. That's that form that Alexis was making fun of me about. That's a 4-page, I think, or 6-page form, but there's only 2 pages that you're actually filling out. So that's for those plans. If it's an individual retiree plan, you have their own form that's for each one of those because, again, they're CMS managed or CMS monitored plans.
My wife and I are, my wife is the one that's on Medicare, but I'm the retiree.
Oh, okay.
Both district paid.
Oh, okay.
So I just fill out the SISC 3 form?
So you would do the SIS-3 form for yourself, and your wife would do that AGWIP companion care. It's called the AGWIP companion care form, because for those plans, it's that same form. Yeah.
Really quick, this is for Alexis. I apologize, I know you're getting questions everywhere. We have a lot of retirees who are leaving. What are their next steps? What should they be doing? What should they be aware of? Can they make an appointment? What should they do?
Okay, so I am behind everybody, which I apologize, but you kind of know what I look like now. So yeah, the next steps are we want to make sure that you have the available forms to enroll in the associated plan that you're looking to enroll in. And we want to make sure that we receive those plans back in Human Resources. If you are enrolling a spouse or dependent children, we would need the verified information for that as well. If you are if you're over the age of 65 and are eligible for Medicare, we would need a copy of your Medicare card also to accompany your enrollment into an over 65 plan. We have about 5 people in the office who are available to meet with retirees. I'm averaging about 4 to 5 retirees a day, meeting with them. The meetings have taken anywhere from 10 to 30 minutes, just because once we kind of drill down what the best option is for you, it's very easy to fill out the forms. So the next step really is to, one, understand which plan you want to enroll in and find the associated enrollment form to go with that. In the letter for those over the age of 65, we did the comparison of if you're looking to enroll in this plan, these are the forms you need to complete in order to do that. So we would want to make sure we have the forms into Human Resources with the associated dependent eligibility verification, which would be tax return or birth certificates, depending on whom you're enrolling, and then your Medicare, copy of your Medicare card. If you're under the age of 65, it's that SISC-3 enrollment form listing out which plan that you want to enroll in, as well as any dependent eligibility verification to go with that. Again, the tax return for your spouse or birth certificates for children. And you can certainly make an appointment with myself. I will be here lingering to talk with anybody who needs to. We can make an appointment to meet at a later time to go over the plans with you directly. And then you can always send an email to hrbenefits@mountsac.edu, and we can create a way to set up an appointment to come in later as well. My name's Alexis Carter. My email is alexis.carter mtsac.edu. That's mtsac.edu. HR benefits at mtsac.edu. So you can email me directly with questions, or you can email the health and welfare email directly. Just know that, you know, we're working to get to all of you.
Any other questions? Okay.
If you're paying CalPERS directly and reimbursed by your district, I'm assuming then you will have to not get insurance the next year, that they won't know because you paid them direct.
That's a CalPERS question. I don't know the answer to that, to be honest with you.
So that'll be an Alexa's question. She'll be able to handle that. Yeah.
I'm sorry, I was talking.
If you're paying CalPERS directly for your insurance,
yes,
and then you're later reimbursed by the Mt SAC district,
oh, yes.
do you need to notify CalPERS that you will not be re-upping in 2020?
No, CalPERS has been notified for all employees and all retirees that their coverage through CalPERS will cease December 31st, 2019. And effective January 1st, 2020, you will no longer be covered under CalPERS. They are aware. They were notified in August. We all went to board for CalPERS in September, and they're aware. Did I answer the question?
Yep,
okay,
that answered it.
Sorry.
Any other questions? Right here.
Next year, when we go through this, will we have just a short form to fill out?
That's a really good question. I actually heard that one.
Yeah.
So next year, where we're going to have to go through all this again. As long as you're maintaining the same, there's nothing that you have to do. So as long as, unless you're wanting to make a change to your plans or change from one to another during open enrollment, you don't have to do anything else.
And you will get a notification, yeah, from the district. And that open enrollment is happening in spring or summer?
Whenever you folks want
Yeah.
to hold it. I want to, yes.
Thought it was like
yeah.
summer. So, but it will be an easier process. Once again, if you don't change any of your elections, then you don't have to do anything. But even though you may choose that medical plan, like this time you choose the 100A plan, but then next time you want to choose a different plan, you can still do that.
Yep.
Any other questions?
Oh,
right back there. Yes, the rates for dental and vision will be paid for by the retiree.
Correct.
The medical is paid for by the district.
If you're ineligible, right.
And this is just the first year we've taken it to negotiation. So hopefully, moving forward, there you go. Any other thing before we wrap up? Okay, well, we'll still be here after.
Yes, and thank you everyone so much for your time. And yeah, we'll be here if you want to ask us some one-on-one questions. Thank you so much for your time and have a great rest of your day.
Great. Thanks, everybody.
Thank you. Thank you, sir.